Hi, how are you today?
Good.
Good. Okay, so we're doing a crown for you today. Is that okay? You're good?
Yeah, it
You're
was
prepared
yeah,
for that?
it was
Okay, great. Okay, I'm gonna go get a faculty to get my start check. All right, I'll be right back. Okay, so I told the faculty they're gonna be coming in a little bit, so we'll just sit here and talk. So you're doing good? Your family's good?
Yeah, they're
Family,
good.
dog.
Yeah, my daughter just had her kindergarten graduation.
Oh, okay, so that means she's like 5,
6, yeah.
6. Okay, good.
Good morning.
Hi, Dr. Payne.
How are you doing today?
Good. How are you?
What do we have going on today?
Okay, so today we're doing a crown on her tooth.
Okay, what tooth are we doing?
Number 30.
Have you done your start check yet today?
I have.
Okay, tell me a little bit about it.
So she is a 20-something-year-old female. She's in pretty good health. She has a kid who just graduated from kindergarten.
Okay, can you tell me about her medical history, please?
She's had pretty good health so far in her life.
Okay, what about her blood pressure?
Generally, it's been pretty good. Nothing alarming.
And what exactly does pretty good mean?
Within normal range. You know what? I'm gonna check it right now with the
Okay. You know, you should be doing this before you bring me in.
Yeah, I got a little nervous and forgot. So just have it.
Okay.
Okay, cut. So we're going to take your blood pressure.
Is that the only cuff you have? You don't have a brachial cuff?
I do have a brachial cuff. Do you want me to take it with that one?
No, just do it with this first. Now, do you understand why we need to be using a brachial cuff?
Can you give me a refresher?
Okay, if you're ever going to use this, you have to have them cross it over their heart first. This is totally inaccurate. Your patient has her legs crossed. Are you even competent to take blood pressure? This one will not give you an accurate reading. I want you to take this off and take the brachial cuff and do it then.
Okay.
Those other cuffs have to be calibrated. Do you know when the last time that cuff was calibrated?
No, I'm borrowing it from someone right now.
So you have no idea if it's ever been calibrated.
Maybe.
Okay.
Can you uncross your legs, please?
Has that radial cuff been calibrated ever before?
I'm not sure. I'm borrowing it from a fellow classmate.
Okay, so you have no idea.
No, ma'am.
Okay, I need you to take the blood pressure with the brachial cuff.
Okay.
Okay, I need to stop you. Have you ever taken blood pressure with this cuff before?
A long time ago, yes.
It needs to go on her bicep.
Okay.
You have no idea what you're doing, do you?
No.
And you're going to do a filling on her today? Or a crown?
A crown.
And you can't even do the blood pressure. Well, hurry up and take it. I have other patients to see.
Okay, cut. Okay, so we're going to take your blood pressure now. rest it here.
Don't forget to have your patient
Oh.
uncross her legs.
Oh, can you uncross your legs, please? Thank you.
Good. It's a little tight, huh?
Sorry about that.
Your blood pressure seems a little high. Miss Willis, I see in here that you've had a baby recently.
Yes, a few years ago.
Okay, did they say anything about your blood pressure there?
My doctor mentioned it a few times, but, I mean...
Did they prescribe you any pills of any sort?
No.
Okay. So on here you can see that her blood pressure is high, but there's not a guarantee that this cuff is accurate. It needs to be calibrated at least once a year.
Mhm.
Do you know when this one was last calibrated?
No, I don't. I've been borrowing it from a classmate.
Okay. Do you have a manual cuff?
Do, yeah. Maybe use that instead.
Yeah, that would be great. It will give you a more accurate reading, especially since she has an underlying medical history. It's important to make sure that her blood pressure is good.
Okay.
Ms. Willis, I just want to remind you, this is a teaching facility, so we're helping our students along the way.
Oh, yeah.
I hope you understand.
Of course.
Okay, great.
Okay. Put it up here.
Looks good. Don't forget your stethoscope.
Okay. Is that too tight?
No, it's great.
Okay, put that down.
Very good. Now just remember, every time you do this, have your patient uncross her legs
Okay.
and just think happy thoughts. Now you want to listen for the sound of the beat of her heart, her pulse, and let me know when you get the blood pressure.
Okie doke.
You hearing anything?
Mm-hmm.
Okay, what'd you get?
122/79.
Okay, very good.
Is that good?
Yeah, that's great. 120/80 is ideal. Very close to that.
Sorry about that.
Okay, cut.
Just gonna put this in and look around.
Christine, how's it going in here?
Good. We're about ready to begin doing the crown part. Did you want to take a look? Want to use the mirror?
Oh, no, I don't need a mirror. Can you just have her open?
Okay.
Mm-hmm. Yep, looks good. You know what, actually, when is the crown due to go to a lab?
Actually, it's due today. I don't know who set that deadline up.
And you have
Kinda
30
know.
minutes left in this appointment?
Yeah.
We're not going to do a crown. You're going to do an MOD resin modified glass ionomer.
Okay. And can you give me, what was that? A resin modified glass?
You
Can
practiced it last semester in my class. I taught it to you. You don't remember?
I mean, it was a long time ago, and it's probably in the afternoon, so I don't really remember a lot of it.
So you slept through my class?
I didn't sleep through it. I may have just looked around and...
Okay, well, you can do this.
Okay. Okay, we're just gonna take a look in here. I've already told Dr. Payne to come over here whenever we're done.
Okay.
How's it going in here?
Good, good, good. I think we're about ready to start doing the crown part. Do you want to take a look and use the mirror? Or
Well, what kind of crown are you doing?
zirconia crown.
I don't need a mirror. Just let me take a look. Open your mouth.
Okay. Here you go.
And when is the crown due to go to lab?
I don't know. I was told it was due today.
And you have 30 minutes left in your appointment?
Yeah.
We don't have time for that. We're going to do an MOD, resin modified glass ionomer. Can you do that?
Resin glass what? Can you repeat that?
Resin modified glass ionomer. You practice it in my class.
It was you that taught it?
You don't remember? Did you sleep through my class?
I mean, it wasn't exactly the most riveting materials after lunch, and probably had a good burger or something.
Okay, well, you can do it. You can figure this out.
Okay. I mean, if you think so.
Awesome.
Just gonna take a look in and show Dr. Payne what we have going on here.
Hi, Christine. Hi, Miss Willis. Okay, so we're going to do a crown today. And do you remember when the last day to send the crown to lab is for the summer?
The last day is actually today.
And you have 30 minutes left. Let me take a look. You know what? I tell you what. I really don't think there's enough time to do a crown in the 30 minutes to do a good job.
Okay.
And since the crown has to be done by today, we need to consider other options. Why don't you get all the caries out and do a MOD buildup, get the patient comfortable, and prepare her so that when we come back in the fall, we could do a crown then with a zirconia crown.
Okay.
Do you have any questions?
No questions.
Okay. When you take out the caries, I want you to keep in mind that you want to go slow with your high-speed hand piece and drop your box really well on the mesial and the distal. When you go to build it up, I want you to make sure you have really good anatomy. We want to make sure the gingiva is really healthy, so when it's time to put on the crown later, you don't have a tough time.
Okay.
Do you understand what we're talking about here?
I think so.
Okay.
Just
do you
a
have any
temporary
questions?
solution, so we'll do it later.
Exactly.
Okay.
Yeah, I want to make sure you have the best care possible, and with 30 minutes left in this appointment, I think this is the best route to go.
Thanks, Dr. Payne.
You're welcome. Okay, Christine, how's it going in here?
It's good. Having a little trouble. Do you mind taking a look? Here, you can use the mirror.
Sure, no problem. Is your treatment plan this for a crown?
Yes.
Okay. When is the next time the crown has to be sent to lab? What's your last day?
The deadline is actually today.
Okay, and you have 30 minutes left in this appointment. I'm concerned that you won't have enough time to remove all the caries and prep this for a crown in 30 minutes.
Okay.
So I'd like to alter the procedure a little bit. Can you do an MOD buildup with resin modified glass ionomer?
Okay. Can you give me a little refresher on what exactly that is? I'm not very
You don't remember how to do this?
I would just like a refresher. I'm not very confident
That's okay.
in it right now.
No problem. I want you to go to the dispensary and get 4 things. They're going to give you Fuji, a gun, a conditioner, and a varnish. When you come back here, set it all up, and I'll come back when you're ready. We'll go step by step, and I'll teach you how to do it.
Okay. And with regards to the crown and with the buildup, what should we have to look out for this summer?
Well, Miss Willis, let me explain a little bit what we're doing. We were originally going to do a crown, but there's really not enough time to do a good job. So we're going to remove the decay so that the tooth doesn't have risk of infection, and we're going to put a temporary in there. When you build it up, I want you to make sure you have really good anatomy. Make sure there's no overhangs because I want the ginger to be really healthy and ready when we come back in the fall. Then we can get the crown sent to lab and place the crown in the fall. Do you have any questions? Okay.
Thank you.
You're welcome.
I don't know why she's freaking out about blood pressure. It's not like we're going to be taking, I'm going to have an assistant. I'm going to be a doctor. I don't need to do that. And resin, glass, whatever that was, like, it was 1,000 slides on a Friday afternoon. I don't know why she expects us to remember it. Plus, it's going to, whatever. She's so mean. You know, Dr. Payne really bailed me out on there. I should have reviewed everything before I started the procedure with the patient. And if I'm going to be a great dentist, it's because she's a greater dentist. I'm just going to look at everything the next time before I do a procedure.
Okay, I'm an actuary, and I know that the blood pressure cuff doesn't go down here. I mean, what do they teach them in dental school? Like, but that Dr. Payne, that redheaded lady, there was no excuse for that. I mean, I almost got up and walked out. She was bad. I'm glad I didn't go to dental school. Do you think I can get another student? Do you think I could be transferred? Christine was a little clueless, but I mean, I get it. They're in school for a reason. You know, I was that way when I was learning too, but Dr. Payne was so good and so patient, and I can tell this is a really great institution.
I'm so frustrated with students like Christine. She's clearly unprepared. She clearly slept through my class. I gave them 200 slides on resin modified glass ionomer, and she had no idea what I was talking about. Did you see? She didn't even put the blood pressure in the right spot on her arm. This is why teachers say that we're babysitters. I don't even get an opportunity to teach. They don't even treat the patient like a patient. She's just, all she cares about is her requirements. I'm really frustrated and annoyed. Christine is really sweet. She is a little clueless, but I'll be honest, I really think she prepared for the crown. To throw something at her like a resin modified glass ionomer, I get it. We did it on a Friday afternoon a year ago. It's not that she's unprepared, it's that these students get hundreds of procedures that they're expected to know how to do on these patients. You know, it takes time out of my day to take care of the patient, but the best way I know to take care of the patient is to take care of students like Christine. She's a hard worker and she'll get it eventually.